What should expectant parents look for in a hospital when they are planning to have a baby?
This is one of the biggest decisions a patient's going to make when she's having her baby. And there are several things that are very important that she has to keep in mind. The first thing is you have to be very certain of the hospital's safety record. You have to be very certain of their record in terms of their nursing care and their physicians. It also is very important that the patient chooses a hospital based on where her doctor is going to be delivering. That's a very, very important thing that she needs to assess immediately when she first becomes pregnant and starts seeking prenatal care.
How can I find out about a hospital's safety and success records?
An excellent resource for patients and their husbands is the Healthgrades website. That would give you an idea of the hospital's safety record in obstetrics and in neonatology.
I hear that Winthrop has a childbirth safety team. What's that about?
I'm very proud of Winthrop's childbirth safety team. The childbirth safety team is a multidisciplinary team, which means it's comprised of many different types of people. There's nurses, physicians, anesthesiologists, mid-level providers such as physician assistants and nurse practitioners, nurses of all different backgrounds and training that take care of an emergency when it comes up. This team prepares very, very carefully for emergencies. They conduct simulations or drills on a regular basis, and we have didactic training sessions that we perform regularly. There are also a rapid response team and an obstetrical crisis team that are specifically geared for the obstetrical patient and the emergencies which can come about during an obstetrical stay.
What is the benefit to having a neonatal intensive care unit?
The neonatal intensive care unit is a very, very important aspect of a hospital. When a patient delivers, there's a chance that her baby may have a poor transition outside the womb. The neonatal intensive care unit has the technology and the staff prepared to take care of that baby. In the event there's a problem with the baby in terms of a malformation, illness, or special needs, the NICU staff and their physicians will be able to take care of this baby in the best possible way. Winthrop is a regional perinatal center, which is a state designation, which recognizes the fact that we have the highest quality of NICU care.
What is a regional perinatal center?
A regional perinatal center is a designation that a hospital will receive from New York State. What it does is the state acknowledges that the hospital, through its administrative support, is able to provide the highest level of obstetrical and neonatal care to their patients. It also charges the hospital with the mission of educating their affiliates in terms of best practice and in terms of quality assurance programs.
Is there a benefit to giving birth in a teaching hospital?
Absolutely. A teaching hospital provides the highest level of care for patients. It has the highest level of supervision by people who have a wealth of medical experience. It also has the highest level of technology. Teaching hospitals go through tremendous evaluation from different governing bodies and authoritative bodies in this country. So if a hospital is a teaching hospital, you can rest assured that it is the finest that there is.
Who decides whether a mom needs a C-section? And does the patient have a voice in that decision?
The decision to do a cesarean section is based on the obstetrical needs of the patient. Ideally, this should be made by her physician. However, the American College of OBGYN does recognize that a patient may have a say in the way she is delivered. Therefore, if a patient strongly desires a primary cesarean section, just at her request, that will be honored by her physician.
I hear a lot about women being scheduled for C-sections. Is that a good idea?
A scheduled cesarean section many times is appropriate. The important thing is that the patient needs to be at term, 39 weeks, and the baby should not be delivered prior to 39 weeks unless it is medically indicated.
What about being scheduled to be induced?
A scheduled induction may be necessary for medical or fetal reasons. However, if there is no medical reason for the mother to be delivered, it is best to wait for nature to take its course. Nature does a better job at delivering babies than inductions.
Where can I get more information about giving birth at Winthrop?
For more information about delivering at Winthrop, you can consult the internet, winthrop.org, or call 1-866-WINTHROP.